Irritable bowel syndrome, or IBS, is a common disorder that affects the large intestine. It's a chronic condition, meaning it can last for a long time. People with IBS experience a range of uncomfortable symptoms. These symptoms include abdominal pain, cramping, bloating, gas, diarrhea, and constipation. IBS is different from inflammatory bowel disease, or IBD. The exact cause of IBS is unknown, but several factors may play a role. Living with IBS can be challenging, but there are ways to manage the symptoms. Consult a doctor for proper diagnosis and personalized treatment. With the right approach, people with IBS can live full and active lives. The exact cause of IBS remains a mystery, but several factors contribute. One key factor is the gut-brain axis. This involves nerves, hormones, and the immune system. Stress can disrupt this axis, leading to IBS symptoms. Stress hormones affect gut motility and bacteria. Abnormal muscle contractions in the intestines also play a role. This can cause diarrhea or constipation. Some people have heightened gut sensitivity. Understanding these causes helps develop effective treatments. Targeting these factors can improve quality of life. Risk factors and prevalence. IBS affects millions worldwide. Certain groups are more susceptible. Women are twice as likely to experience IBS. Hormonal fluctuations and pain perception may play a role. IBS is more prevalent in younger individuals. Family history also plays a role. Other risk factors include gastrointestinal infections and mental health conditions. Recognizing the signs and symptoms of IBS. IBS manifests differently in each individual, but some common symptoms characterize the condition. Abdominal pain is a hallmark symptom of IBS, often described as cramping, aching, or a feeling of fullness. This pain is typically located in the lower abdomen and may come and go in episodes. It is often relieved after a bowel movement, suggesting a link between pain and changes in bowel habits. Changes in bowel movements are another key feature of IBS. Some individuals experience diarrhea, characterized by loose, watery stools and an urgent need to defecate. Others may experience constipation, characterized by hard, dry stools and difficulty passing bowel movements. Some individuals experience alternating periods of diarrhea and constipation, highlighting the variability of IBS symptoms. Bloating and excessive gas are also common complaints, contributing to discomfort and abdominal distension. Other symptoms that may accompany IBS include mucus in the stool, a feeling of incomplete evacuation after a bowel movement, and fatigue. Recognizing these symptoms is crucial for seeking timely medical advice and receiving an accurate diagnosis. Managing IBS treatment and lifestyle changes. While there is no cure for IBS, the good news is that it can be effectively managed with a combination of treatments and lifestyle modifications. The first step is to consult with a healthcare professional for a proper diagnosis and to rule out other conditions with similar symptoms. Once IBS is confirmed, the treatment plan will be tailored to the individual's specific symptoms and needs. Dietary changes are often the cornerstone of IBS management. Identifying and avoiding trigger foods that worsen symptoms is essential. Common trigger foods include fatty foods, spicy foods, caffeine, alcohol, and certain types of carbohydrates known as FODMAPS. FODMAPS are poorly absorbed in the small intestine and can ferment in the colon, leading to gas, bloating, and other IBS symptoms. Stress management techniques such as exercise, yoga, meditation, and deep breathing exercises can also be helpful in reducing IBS symptoms. Stress can exacerbate symptoms by disrupting the gut-brain axis, so finding effective ways to manage stress is crucial. The importance of doctor-patient collaboration. Managing IBS is a journey that requires a strong partnership between the individual and their healthcare provider. Open communication is essential for ensuring that the treatment plan is tailored to the individual's specific needs and that any concerns are addressed promptly. Regular checkups are important for monitoring symptoms, adjusting medication dosages if necessary, and providing ongoing support and guidance. It is also crucial to remember that IBS is a chronic condition, meaning it requires long-term management. There may be periods of time when symptoms flare up, and other times when symptoms are well controlled. It is important to be patient, persistent, and proactive in managing IBS. By working closely with a healthcare provider, individuals with IBS can develop coping mechanisms, identify triggers, and make lifestyle changes that improve their quality of life. With the right support and management strategies, it is possible to live a full and active life despite the challenges of IBS. MD Searchlight. Be your own advocate.